or relied on for any diagnostic or treatment process. It should not be used as a substitute for professional diagnosis, care, and treatment. Please consult your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition. The opinions expressed and the content shared by Dr. Forrest are not necessarily the opinions and content of the Dementia Society of America. Thank you.
All right, so at this point, you should know that we are recording, and that way this information can be posted to the Dementia Society of America website, and people can listen later. And later on, when you do ask questions, we just ask for your own privacy that you just use your first name. All right, so let's get started. How to communicate when words no longer make sense. I come to you with this program not only as a researcher, as a clinician, with a private practice working with people with various types of dementias, but I come to you prepared with a background as a family caregiver myself. My mom had a vascular dementia over 20 years ago. And it was really this story, her situation, where I was so perplexed, especially as it came to communication, when her words just didn't make any sense to me, and I didn't know where to go. There was much less in terms of resource or other healthcare providers who knew what to do. And so I'm hoping I could be somewhat of that person I was looking for and offering this webcast. Also, I'm currently standing by my side of my sister, whose husband has early stages of Alzheimer's related dementia. So it has been not only a professional passion, but as a family caregiver, there's certainly a need for a lot more information, and we're hoping that Dementia Unplugged really starts to address some of those needs. Communication. I want to start out by saying there's really 3 elements that are involved when one communicates. That includes body language, tone of voice, and the spoken word. And it may not sound intuitive, but it really is our body language that communicates the majority of what we want to say. The second is tone of voice. And lastly, it's our words. So on the screen is a picture of an older woman. A slide ago, she had a happy face, and now she has her hands covering her face, and without a word, we might surmise that she's in a bit of distress. This may be familiar to you. Let's say your boss walks into your office without saying a word. You can take a look at facial expressions, gestures, posture, and maybe communicating something to you without even having to tell you what's on their mind. This whole concept, it becomes more and more critical when caring for a loved one or a patient or a resident with some form of dementia. You begin to rely more heavily on the nonverbal communication. So this concept also is what I call bidirectional. Not only do we look at one's facial expressions and gestures and posture, but we have to be mindful of how we're presenting ourselves at the same time. And so people are listening to our nonverbal communication and watching our body language, picking up messages. So this is an ongoing bidirectional process. When it comes to dementia, just a quick sort of background that I want people to know is when I'm thinking about this, I want you to think about the brain as sort of our supercomputer. This is the organ that not only coordinates and helps us to speak clearly, use language, use phrases, use terminology, recognize objects, but at the same time, it controls all of our muscles, including our mouth, including our ability to control everything from bladder to bowel, the ability to swallow. And the mechanisms in terms of communication have to do with the volume of breath, the ability to use our tongue. So all of those things over time begin to change when we have various types of dementias. And they all present a little bit differently. There are over 50 different types of dementias. And so this whole concept becomes even more complicated over time. The bottom line, as we move forward in these slides, is that I want you to know right off the bat that one can communicate regardless of words. So as the dementia progresses, you're going to have a shift from the use and the facility of using words and language to focusing on the underlying emotion that you hear behind the words. It's the tone of voice. It's the pacing. Is it a sense of distress or calm and cheeriness? And later, as we move towards the later stages of dementia, we communicate and connect through the senses, such as touch, taste, smell, hearing, vision. Our ability and the people that we care for, their ability to communicate varies based on the stage of dementia, early to late or final. Again, the type of dementia. And the foremost prevalent are Alzheimer's related, Lewy body, frontal temporal dementia, and vascular dementia, and many, many more. If somebody has an underlying hearing or visual problem, that's going to impair one's ability to communicate just on its own. Add the dementia to that, and it can magnify some of the problems. A major point I want to emphasize in terms of communication is that it, what I call, worsens when someone is more anxious or is more fatigued or has some sort of pain. Just think about your own self. If you've ever been in a classroom situation and let's say you had the wrong answer. Well, you're probably a little less likely to raise your hand on the second point. One typically or can become more anxious. That anxiety interferes with the ability to concentrate. And that happens especially for people with dementia. And later on, it'll emphasize the importance of sort of decreasing anxiety and making sure someone doesn't become over fatigued. This whole issue becomes more prevalent with a term you may have heard in the past called sundowning. It's a phrase I would actually like to eliminate because in the past we used to think that people became more distressed as the sun went down and something to do with lighting, but actually that's not the case. We've learned that it's really an over fatigue of the brain throughout the day. And that just so happens by late afternoon. And so research in my clinical practice has shown that if we allow a person to rest a couple times during the day after lunch and before dinner or after breakfast and before dinner, just have someone listen to quiet music. Some people pray, some people take a nap, that by mid-evening, this whole problem of what we used to call sundowning really dissipates. So I just wanted to make sure that you're familiar with some of the major factors that can impede one's communication. Now, I'm going to give sort of a list of other potential changes. And if there are any callers who are concerned about their own cognitive ability or own concern that they may have a dementia or have been diagnosed with a dementia, these are potential changes, and they vary with the type and the stage. But I want caregivers to know what could be possible given sort of an unknown disease. And so we will be exploring some of these more troublesome problems that typically we don't have a real a sense of how to make it better. And that's why you're here, and that's why you're listening. So the first one is it often takes much more time for the person to take in information and process it. There is a part of the brain called the hippocampus. It's about the size of a walnut, and it's our recording button, meaning that it takes in new information, stores it so that we can use it in our working memory. Well, for various types of dementias, and especially in Alzheimer's type, this is one of the first part of the brain that really starts to be impaired. And so it takes longer. What you may hear are people repeat the same questions over and over and over again. And you're wondering, should I answer over and over and again? And I'll tell you yes. You may think, should I speak more loudly? This is when caregivers often get frustrated, thinking, oh my goodness, I thought I told you, 15 times already. People have problems with word finding, names, naming objects. So they may use related words. So let's say you want to talk about the watch. Well, some people might say the clock on my hand. Others may use a variety or a jumbled words, some that just seem so disparate and disconnected. Call that word salad. This is especially the time to listen to the underlying tone to get a sense of what people are trying to say. Another piece is that individuals may no longer initiate conversation or ask many questions. And that can be from a variety of reasons. It could be because the frontal lobe, which is responsible for our, what we call executive functions and planning and sort of coming up with what to do next or what to say next, is now being changed. Or people are afraid of being embarrassed. Other potential changes include seeing or hearing things that don't exist. These are visual and auditory hallucinations. Others lose the ability to recognize objects, and there is a distortion in the visual area of the brain. And so, for example, let's say a channel changer for a TV may be thought of as a telephone, or looking at someone's toothbrush. Here's something that should be very familiar, but it's not, and people don't know what to do next with this object. Individuals with various types of dementia may speak of events primarily that happened in the past. That's because, again, the hippocampus is really no longer working at its peak, and so people rely on longer-term memories, things that happened in the childhood or teenage years. Vocabulary can shorten to just a few words. And so we rely on what people are trying to communicate based on how they say those few words. So I had a client who could say, "You are my sunshine." And based on those few words, I was able to tell if she was in a good mood or if this is going to be a rough day. Some clients, some loved ones become mute. Not always, but even so, the good news is that people can still communicate and often can pull on long-term memories, especially through the use of music. So when we talk about communicating through the senses, I'm going to emphasize this again. So given all the possibilities, I do want to say a good way to start out as a care provider, as a care partner, is to think about what this must be like from the inside out. And recognize that there are many cognitive functions that still remain. The brain is an amazing, complex organ, and it's our new frontier, and we're really just beginning to learn the full capacity. So even though things are changing, what remains is, and I'll stress again, the ability to communicate through body language, tone of voice, always the ability to sense love, connection, and compassion, the ability to be in the present. So I think that's, if you're going to say anything about gifts of dementia, it really, in a way, puts a framework around the ability to no longer be worried about things in the past or your long to-do list in the future, but it gives one the ability to enjoy the present. Also, one's life history is never erased. Those preferences stay with the person with dementia. And it's their inner essence, some people call it their spirit, their soul, that does not go away. And it's the caregivers and the care partners that have the preferences in mind and keep that memory alive. So care partners, caregivers, it's our responsibility to adjust our approach. We can never think that the person with the dementia is doing any of these things on purpose or trying to manipulate you. And I've heard those phrases before. It really is incumbent upon us. The visual I'd like you to think about is a brain, or instead of that, let's just say you had a broken leg with a cast. That fractured leg, we know about it because we see a cast. Well, we don't see a cast around one's head or cranium. And so it's easy to forget that some of these changes are happening in the brain, and we expect some things to happen when we know that's just no longer possible. So we see a person through, I would highly recommend, through a lens of compassion. And compassion really means understanding that person's pain or suffering or distress. So it's understanding, meaning learning more about why these things are these changes in communication are happening, but with the desire to mitigate it, meaning the desire to adjust our sails, our approach, so that communication could be easier. So here are a few helpful hints that I find very common and useful when I work with family caregivers. Number one, please be flexible and willing to learn these new strategies. They're not intuitive. We live in a very hyper-cognitive, linear, rational world, and it's hard to imagine sometimes the way that we have to sort of rethink how to communicate. So one way is to eliminate background noise, so it's not competing for the person's attention. Face the person at the same level so they can see you and your facial expressions. Also, pay more attention to your own nonverbal behaviors and tone of voice. An individual can easily absorb if you're looking or sounding frustrated or grumpy or have an angry sort of facial expression. And people reflect that and absorb it. Talk more slowly because it takes longer for information to be processed, and allow more time for answers. Don't ask repeated questions at the same time. If someone does repeat questions, answer it as if it was the first time, every time. Now, that's not always easy. And so at some point, you may want to sort of refocus or redirect, sort of changing the conversation a bit. Lastly, at least on this slide, I'm going to encourage everyone to use what we call dementia-sensitive language. So things like, let's say someone becomes incontinent and it's time to help them toilet and change their underpants. Well, you don't want to say to someone in their 70s, it's time to change your diaper. I also use the term someone living with dementia instead of demented. Now that's a term you may hear in the medical texts, and some healthcare providers may say something to that effect. But I'm going to encourage you to soften that language to make it a little more friendly. Ultimately, I see this becoming much more of a sort of a chronic disease that I think we're going to learn much more in the years to come. But at this point, we're learning how to care sensitively, respectfully, until we find a cure. Other do's and don'ts. So we'll start with the don'ts. Don't quiz or test someone's memory. I hear people say, okay, Mom, what's my name? What's my name? That brings on the anxiety, and it makes both parties frustrated. Don't speak over someone, the person with dementia. It makes them feel like they don't exist in the room. Don't ask multiple questions at the same time. And here's one. Don't argue or try to convince or rationalize. You will never win. That part of the brain that allows for sort of self-awareness and insight is changing. And so you can go back and forth about one's ability or not, and it leaves both parties frustrated again. So it's always time to recognize what people can do versus what they can't do. So don't argue or rationalize. A couple other thoughts. Guess. If someone's struggling to find a word, I always give them time to say, let it bubble up. But if, after a minute or so, then give it a guess. Give it your best guess. It lets them know you're paying attention, but you're not at the same time trying to make them anxious to make the conversation go too quickly. Here's that deep listening again, listening to the tone of voice and body language. Enjoy listening to stories of the past, time traveling. I spent an afternoon with a client of mine this afternoon, and I learned all sorts of wonderful things about growing up and how resilient she was and her family during the Depression. And she was telling me as if it was happening right now. So we call this time traveling. It would not have been helpful for me to say, well, we're in 2019 and that happened so many years ago. That would just been confusing. So just went along and I learned. Another point is to stay calm, especially if someone does get upset or distressed. Again, not always easy, but people will reflect your mood and behavior. And if they're distressed, the best thing to do is stay as calm as possible. The last piece I leave you with is focus on remaining abilities. So if someone can't speak in full sentences, and that's okay. We can still get the gist what someone wants to communicate. If that's no longer possible, we may speak through song. And that brings us to the senses. So imagine just being together and bringing out, cones of delicious chocolate ice cream. In that moment, we can connect just enjoying that taste and that texture. Don't have to say a word. We can just see the pleasure on each other's face as we're enjoying that ice cream. Other senses, I move to the next slide, and music. There's a lot of research, again, that goes to the importance of communicating through rhythm, through melody. Think about how many songs that you can remember from your teenage years, all the verses. And if I told you to tell me what happened yesterday, there may be a blank, right? So it's through that music, through that repetitive wording and phraseology that can bring up memories of first dates and being on different events or what happened in your childhood. The important part about music is using preferred music, and everyone has their genre of music that they delight in. So make sure you know somebody's preference. One of the last visuals I want to leave you with is that of a woman touching a velvety red rose. And imagine that she's inhaling the sweet aroma at the same time. That's a multi-sensory experience. Same thing as giving someone a hand massage with their favorite scented lotion, let's say lavender. And maybe at the same time, we're singing to them something like, "Let me call you sweetheart." And all those together are amazing ways of connecting, which is a form of communication. It's much more rich than spending, just sitting next to someone, perhaps watching television, where there's very little interaction. So if people are concerned about how do I communicate, especially in the later stages of dementia, hold that loved one's hand, bring their favorite lotion, and start to sing. I want to leave you with this quote by Maya Angelou, and I think it fits for all of us. "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." And that takeaway is something I really wish to leave you with. People with and without dementia will always remember how you made them feel. They may not be able to articulate that, but there's actually research that shows in PET scans that people who've had a positive experience, their PET scans light up, and that image and that sense stays long after the stimulus leaves. So after a positive visit, even if that person doesn't remember that you were there 10 minutes later, it meant everything at that moment, and that positive affect and that positive sense that moves through the body, that stays. And that is sort of a major lesson I hope to leave you with. So on that note, what I'm going to do is open this up to the participants, and your first name. We want to be able to just keep your privacy. So I'm going to stop recording.